Yeah, hi everybody. My name is Christopher McDonald. I'm with Optimus, and we're going to be recording a quick demonstration of some ophthalmology clinical content that we created to use in GE Centricity CPS. The content is being used by about 10 practices around the country, and what we wanted to do is just give a quick demonstration to kind of give you a flavor of the methodology we use for creating this content and what you would expect if you wanted to use it yourself. So what I'm going to be doing is using a test patient. The patient's a 56-year-old male. He's got a few visits, excuse me, in his chart. So we're going to be looking at this as an established patient visit, and I'm going to kind of go through all the content. So I'm going to go ahead and get started. I'm going to choose a ophthalmology visit. I'm also going to use Dragon Medical One voice recognition software. This software is loaded on the terminal server, so I'm dictating across a terminal server session, which is a really common setup for a lot of providers out there that use cloud-based electronic medical records. I'm going to try to keep this presentation to about 20 minutes, just so you can sort of quickly get a view, but not see everything that you could possibly do with the forms. Excuse me. So starting off, we're going to look. This is an HPI. So I can come in. I can see the previous assessment and plan. I can also see the previous HPI. And one of the things that we recognize, and this is really based on about 12 years of experience using electronic medical records, is that one thing that's really challenging with electronic medical records is reconstructing a patient's history. And especially in ophthalmology, this is something that is typically very quickly done in a paper chart. You sort of look at the last visit, you flip the page, what did I do last time, what did I do the time before that. And typically in ophthalmology, these are one-page forms, so it's like a snapshot of everything that happened with the patient that day. And so that's sort of what we tried to recreate here. So this is a historical form. So this is laid out in the way that a paper ophthalmology form would be, with the right eye on your left and the left eye on your right, like the patient is looking at you. You can see up here, this has got everything from the previous visit. You can also click previous and see what you did the time before that. And so this is a fantastic way to sort of see everything in a snapshot. So it helps you to quickly sort of reconstruct that history. So what I'm going to do is sort of show you a few different ways to do this. We have a eye complaints form. So this is typically filled out by the ophthalmic tech. So you can see this has got that point and click functionality. And I'm not going to go all the way through this. This is pretty standard stuff. So what it does is you use a bunch of click buttons, and then what it does is it creates a narrative based on that. But for today, I'm just going to use voice recognition, and I'm just going to sort of cruise through this. I'm going to say this is an emergency visit. And I'll turn my voice recognition on here, and I'll dictate the chief complaint, and I'll go through the HBI using voice recognition. Red, itchy eyes. The patient is a 56-year-old male who presents today with red, irritated eyes, OU, period. The patient has tried over-the-counter drops for the last 4 days with no improvement, period. The redness started 7 days ago, and the itching started 3 days ago, period. The patient has experienced this a few times in the past, but has never come to see an ophthalmologist, period. The patient states that this time the itchiness and redness is much worse, period. And so one of the things that, especially for those mature Dragon users in the terminal server environment, you're going to immediately notice that the formatting is correct using Dragon Medical Online, and that it's really, really responsive. So it's really the best tool to use if you do want to use voice recognition in a terminal server environment. This is really the way to go. So I'm going to jump right to the past medical histories, and you can see here I've got a standard problem list and a standard medication list, and I've got ocular medications, ocular histories, PMH, surgical history, and family history and social history. And the ocular medications and ocular histories really is a place where a provider can sort of have the ability to free type in there, to take notes, and put sort of more narrative style comments. The problem list is a structured list. The medication is a structured list. And so the histories and medications is a place that you can really leave sort of some own narrative comments. And it's also a building block. Notice that when I got here, all of this is filled out. So the provider can just click all reviewed if nothing has changed. And so you sort of, every time you see the patient, you change this by exception. The next form is the review of systems, something that's usually pretty standard in ophthalmology, a pretty simple thing. So the provider can come in and say there's no concerns. They click no concerns. It's going to say denies each system. And let's say if you go to respiratory and that there are some shortness of breath and coughing, and notice that what it does is that it comes in and it puts complaints of shortness of breath or cough. And it puts an X by respiratory to show that there's some sort of something abnormal there. And the refraction form is, this is the visual acuity in ophthalmology is certainly one of the more complicated sort of things to create when you're thinking about electronic medical records. And anybody who works in ophthalmology understands this. The patient, sometimes is a simple myopic patient that comes in, is just looking for an update to their glasses prescription, and that's it. And you get some patients that come in, they've got issues with their near vision and distance vision and their immediate vision, and you have to have enough placeholders in the visit, in the note, to be able to put any kind of scenario. So what we ended up with and what we found works best in this environment is we have a visual acuity form that this is what the patient came in with. And so if I come in and I can arrow down and choose the patient's 20/30, and that's in their distance glasses, and I can come here and say plus 2.00 and negative 1.25 and 080. If there's an add, I can do plus 2.50. I can come to the next field and say they're 20/20 and their distance glasses, and that's plus 2.25, negative 1.25, and 090, and I can say plus 1.00. And so this is the way that you can sort of manually input these in. We've looked at a lot of different ways with like radio buttons to pick the plus minus, and drop downs to pick the actual number value. And we found over time that it's just much quicker to free type it in. There's some more functionality you get here. So if I wanted to clear this, if this is a follow-up patient, I can insert the previous values from last time. That's a really quick way to come in. What it does is it inserts the last glasses prescription, and you can also come in here and change that by exception. So typically when a patient comes in, when an ophthalmic tech might be working the patient up, or an optometrist or an ophthalmologist, and they use sort of the last glasses as a baseline for the 4-opter. And so if I want to use this in the refraction, so we have a refraction here and a second refraction here and a refinement. So in the practice, most practices that I work with, the ophthalmic tech or the optometrist might do an initial refraction. And then once another provider comes in, whether it's the optometrist or the ophthalmologist, they can do a second refraction here. And so I'll just show you that sort of workflow. You have an AR here. This can be hooked up directly to pull from your ARs. And so I'm going to say that this is, we're going to be pulling this in to the refraction 1 and use it as a baseline. So you have a 1-2 refraction here. So I can insert that into the refraction 1 field, and then I can come in and say that when I measured them, I actually got the patient to 20/20, and I added a half a diopter here, and this was 080, and on this eye I got the patient to 20/25, but here I had to add a quarter diopter, and here so take a quarter diopter off the sill. And so this is what happens. So this is the ophthalmic tech or optometrist signs that. And then when the provider comes in, they can just, all they have to do is if they want to accept this refraction, they just click refinement. And that puts it down here. It signs the provider's name. And then they can hit print RX to print a prescription in the exam room. That printed prescription can print into a hall, like near a pod printer, or it can print in the optical shop. And this is this functionality is what we tried to do in designing these forms is we wanted all of the data to centralize to one form. And you can see here when I click next form, that's what we're looking at. So in several practices that use these, this is really where the provider starts, the optometrist with the ophthalmologist, and the technician has been doing most of the work up to this point. The technician can come in and caution the patient about dilation. They can insert the dilation time. They can put the orientation. They can put what they dilated the patient with. So they can say maybe it's medriacil and phenylephrine, and they can push that over to the left eye. Same thing with IOP. So they can come in here and say, I checked the patient's pressure. It was 15. I can time stamp that and put my initials. Over here, 14, and time stamp that and do my initials. You can also have a place for another IOP if you want. And we also have an IOP section that I'll show you when I get to sort of the provider part of the exam. It's confrontation fields. I can normalize that, push that over to the left. And then as the technician, I think most of the time what we do is have them do the pupils. They come in and do the pupils and push that over. And as a technician, I'm really done. If there's not any special testing done, which we have some special testing forms for OCT, visual field, fundus photos, color vision, all sorts of in-exam room testing in the lane, and then also sort of special testing that's done in a separate department. And for this video, I'm not going to record all that, but we can follow up and show you that at a different date. So what I'm going to do as a technician, I'm going to put this visit on hold. I'm going to route this to the doctor, and it's going to go to the doctor. And so as the doctor, I'm going to be in my desktop. I'm going to be sort of going through my day. I'm going to see this patient visit come up on my desktop, and what I'm going to do is then click on that patient visit, and then I'll be ready to see the patient. And so as a provider, this is where we get into the heart of the most valuable time in the practice. And so the provider can come in and look, what did I do? What's going on today? What did I do last time? I only look through that previous. I can always jump to the historical form and sort of reconstruct the patient's history. I can go previous. And in a lot of cases, what we find is that the physical exam doesn't change much, right? So the cup size is probably not going to change if they don't have any pathology. They're more than likely you're going to use most of this. So we have these buttons here. So if you're looking at the previous exam, you can click this U button and this U button, and it inserts the right side and the left side exam. So the provider can then go back to the summary form, and all of this is loaded in here. You might come in here and, this patient here is here for an emergency visit. So we might come in and say, comment that the lids look swollen. Here on the slit lamp exam, crusting, redness. I have to warn you, I'm not an ophthalmologist, so bear with me on some of my describing this pathology. And you can see here that I'm essentially done with my physical exam. It brought in some of the macula exam from before. If that's all the same, you can confirm it, or you can update that as well. And I'm ready to move on with the patient. So I'm going to jump over to the assessment and plan. And what we're going to do is this is going to take you over to a problem-focused assessment and plan. And we really spent a lot of time on this. It's important for a lot of different reasons to really have a nice, clean assessment and plan. And this, for the most part, most ophthalmologies depend heavily on referrals. And so ophthalmologists typically are referring back and forth to optometrists from the PCP, managing diabetic patients. So this referral letter is a super important part. And what you don't want to be doing is creating an assessment plan and then a completely separate letter that isn't using the same jargon. So what I really do is try to guide an ophthalmologist and optometrist to start creating your assessment and plan like it's what you're going to be sharing with your referring provider. So I'm just going to demonstrate a quick one here. So what I'm going to do is say the patient's primary reason for coming in is allergic conjunctivitis, and I added these problems on here prior, just for demonstration purposes to try to keep this presentation to 20 minutes. But if you didn't, you could just click New Problem, add this problem. So what I'm going to do is this is the problem, this is the assessment. I can turn on my microphone. Worse in right eye than left. And you can see here, using this problem, I said, I'm going to say worse and right than left. And then on the plan here, I wanted to just demonstrate a really powerful feature of Centricity, and it's called Quick Text. And these are completely customizable by provider. So this is an opportunity for every provider to be able to put their own jargon in here. You can create a list that everybody in the organization uses, and then also you can create some that are specific to the provider. So I created one called .wc, so for warm compress. So I'm going to click .wc and spacebar. You can see here it says warm compress for 3 days, 3 times a day. Advised not to touch their eyes, warned of risk of spreading to family and friends. And so this is some jargon that I'm going to use. So I clicked the problem, I typed an assessment. Sometimes the problem is the assessment, so this can be blank. I check the medication and the plan, and I click add. What it does is it puts problem 1, assessment and plan. Then the patient has cataracts. I'm going to say left eye 2 plus, right eye 1 plus. Yes. Here, I don't believe that we need to do cataract surgery yet, so I'm just going to say follow and add. So problem 1, problem 2. And if the patient was diabetic or had hypertension or anything else, you could sort of continue to do the same thing and you'd have 1, 2, 3. And then I'm going to say I want to see the patient back in 9 months. At that time, we're going to do a complete eye exam. And I'm also going to do a retina OCT and add. And then my return to clinic instructions come in here. I'm going to click next. And you'll probably notice that these forms were created from ophthalmologists. So an ophthalmologist and myself sat in a room. We tried to recreate what we see on a paper world. We were focused on efficiency and quality of the note. So trying to balance those two things. When looking at this super bill, it looks a lot like a paper super bill. And so you can see here the provider, we're going to choose cataract nuclear and allergic conjunctivitis. These are 2 problems that are on our problem list. We're going to use one of the eye codes for a level 4. And I'm going to say we also took some no charge visual fields. You can see here we've got all of our testing here, contact lens services, miscellaneous, E&M codes. These are eye codes, any hospital or retina. We also have the opportunity to put modifiers, and I'm going to hit enter billing. And so that quickly we can enter our charges for this visit. What I also want to do really quickly is show you the drawing tool. So if I wanted to sort of draw on this patient, and I'm using a mouse on this computer, but you can see I have the ability to click a full face diagram. I can open here. I can come in here and choose red and choose my brush style. And this defaults save, so I could come in here and I can choose that there's and a lot of providers that I see will get touchscreen monitors, and that works really well. I can click close and save that, and now that I can attach that diagram to the chart, and now that is there for me to view anytime in the future. So it's a quick way. I know a lot of providers, this is an important feature in the EMR, and so this is a way you can sort of continue to use that functionality. One of the things you'll notice is that in the text translation, which was super important to us, we tried to keep the footprint of the chart note really small. So in most cases, this will print on 1 to 2 pages to have a really nice, concise note. We put all visual acuity into a chart sort of view and into a table view, and it's a really nice, clean way of viewing this. And the last thing I want to show you is the referral letter. So if I click End Update and Sign Document, okay. And what I'm going to do now is just show you a really quick way to print your referral letter. So I'm going to go to Letters, I'm going to click Lexi, and I'm going to hit Customize. And what you can see here is we can pull in letterhead here. We pull in all the pertinent information, the PCP, that you had the pleasure of seeing the patient, and this is what your assessment plan looks like. That can immediately be faxed out to the provider. It can be printed and given a copy to the patient if it's a pediatric patient and you want them to take one to school, or you can have your front desk staff fax or mail that to anybody that you want. So great way to save you some time from transcription. All right, and I hope that answers some of your questions about using ophthalmology in GE Centricity. If you have any questions or need any further help, just reach out to us. Our website is www.optimus.com. Our phone number is 617-848-4488. Thank you.